Now we've got our younger kid, the 13-year-old pitcher with increasing dominant shoulder pain with throwing. So this kid is kind of the classic of what I see because, San Diego is a big baseball area too, and these kids are not just on Little League. They're on the all-star team, and they're on the travel team, so those are all like banners of awards and banners of courage for these guys. Hey, I'm on this team and I'm on this one, but clearly that dramatically increases the load on their shoulder with each team that they're pitching on. And so, I sit there and go, that's great, congratulations, but we have to somehow make sure that we're not doing too much with your arm, and maybe picking one or two of those teams that mean more and pitching on them, but pitching less number of innings to try to make sure that you're not overdoing it. Now, this kid's also the typical age group for growth spurt, so between 13 and 15 for boys, 11 and 13 for girls. He's grown 4 inches just since last season. So all of a sudden, wow, that's a huge change in that arm. That ball is now so much farther away from the body. And this kid is to the point where he's even pulling himself out of practice because of this decreasing pitch speed and inaccuracy. So it takes a few days off and feels a little bit better. So right now, just with that story alone, there's a lot of potential things it could be, right? So we have to start thinking, okay, where would we start with this? But as time goes on, we've done the usual things. So we've tried the typical rest, took him out a little bit, ice, anti-inflammatories, started some rehab, but every time he takes time off and then feels better, after a couple weeks, goes back to pitch, pain comes right back. So we start thinking, okay, this may not make sense to what we were treating him for. So the coach sends him in and tells the parents, he may have a rotator cuff tear. Now, have any of you had a 13-year-old with a rotator cuff tear? No. In my 20-something years of doing this, I've had one 12-year-old with a legitimate MRI rotator cuff tear. Didn't do surgery, did beautifully, healed just fine. And when I was searching through the literature, at that point I just found one case of a 12-year-old with a rotator cuff tear and also did not require surgery. And there's, I'm sure, more that are not reported. But in general, we're not immediately going to think of rotator cuff tear, right? With a 13-year-old, that's just not going to be the first thing on the differential. But of course, and the coach, well-meaning guy, no, I'm not being critical there at all. But of course, the family then came in with, my kid has a rotator cuff tear. So they were already focused on that as their diagnosis, and then having to kind of unravel a lot of that sometimes can take some time. And you guys can also be great as to help support some of those things as we deal with the outside population trying to practice medicine. And the fact that, there's been no acute injury, because in these young kids, if they're going to have any kind of rotator cuff injury, that's significant. It's almost always related to some kind of acute trauma. So in this particular case, it just didn't go along with this scenario. Plus, he'd already been being treated for what we thought would be rotator cuff inflammation. Now, in this particular kid, again, try to find out and localize where the pain is. So where is your pain? Well, can you use one finger? No, I can't. It's just here. So he would always grab his shoulder, and that's the best I can do, is it's here because it went through. It wasn't in one spot, front or back. It was just there. So again, that's kind of a hallmark. I mean, that's not every kid is going to do that, but when they have these particular problems with their growth plate, you're going to often get that. Now, the other thing is when I'm testing him, he doesn't just have the typical imbalance. This kid is pretty grossly weak when testing most all of his rotator cuff, especially his internal and external rotators. And again, that's like, wow, this is his dominant arm. There's no acute injury. It's doubtful he's going to have a tear. He doesn't have any atrophy to go along with a neurologic problem. But he's super weak when I'm testing him, and he has this pain, and he can't participate. That is pretty much when you have to think, bells and whistles, this is your typical Little League shoulder, which is truly a physeal fracture through the proximal humerus. Now, this is the x-ray of the non-painful opposite shoulder, and this is what a normal physis should look like through that proximal humerus right there. And as you can see, it's not a straight line. It's a wavy thing that goes all the way around and three-dimensional. But when you look at the opposite shoulder that's painful, you can see what a huge difference between this growth plate. See how wide that is? That shadowing is enormous compared to this one, which is just a thin black line across there. So This is truly Little League shoulder, which is a fatigue fracture through the proximal humerus physis. Paperclip theory, you bend enough, it finally breaks. You know, these kids throw, and that growth plate is the weakest link. So it's subject to all sorts of forces. It fatigues and finally just comes apart. And then these kids they can't throw. And that's why so much of their rotator cuff testing is painful, because as you can see from that, their internal and external rotators are attaching at different places on that humerus that are pretty darn close to that growth plate. So they're not able to resist you with much ability at all. So those are things that should add up. And I've seen a million of these, so I can look at that x-ray and tell you immediately that's what it is. But if people are unfamiliar, they do need to get the comparison view of the x-rays to see, hey, this is the normal shoulder. Wow, this doesn't look anything like that. Because that's really a powerful thing. So what do we do with that? Well, of course, this kid was overloaded. It was on 2 teams, increased pitch counts, and also going through the growth spurts. So again, the ball farther away from the body, so a lot more of that weight was being transferred up to the shoulder. Muscles were getting stronger. That meant the imbalance that he had was just getting much more profound as his muscles were getting stronger, because the strong ones were getting stronger, the weaker ones were still not gaining that strength. So there was a mismatch of forces. Able to throw harder, but doesn't have, of course, that muscle balance and core and leg strength to support those harder throws now that he's getting some testosterone on board. So those are things that are all forcing this mismatch. So now you've got a growing body that has young adult muscle strength now and more young adult arm lengths, but is having a still child skeleton that is unfit for those kinds of muscle imbalances. So you get that distraction force, those rotational, torsional forces on that growth plate. And my best analogy of that growth plate is it's like an Oreo cookie. It can kind of pop apart and come apart more easily because that's kind of the exact dynamic that it is. So those are things that I think we have to remember when we're dealing with some of these overhead athletes, especially if they're a young person.